The saying, it's who you know, not what you know, is just, it's so true. What you know is incredibly important, but who you know has really been something that's been very valuable to me in my trajectory.
Hello, everyone, and welcome to the latest episode of The Current, Touro University California's Alumni podcast. I'm Glenn Faison, our Alumni Engagement Director here on campus. Joining us today is Dr. Domenica Giovannini. She's a graduate of the Independent Master of Public Health program, completed the program in 2011. Your emphasis was on community health and included a field study in Ethiopia. Is that correct?
Yes, I tried to mix it up.
You definitely did. You came to Touro after receiving your bachelor's degree in psychology from UC Santa Barbara, and after graduating from Touro, just recently obtained your doctorate degree in business administration, an emphasis on nonprofit operations and communications from Touro University Worldwide. So congratulations on that.
Thank you.
You currently serve as the Director of Development and Communications for Rams Inc. here in the Bay Area, and also you have founded and continue to lead the consultancy at MaberMe. So thank you for joining us today. Just to let everyone know, we're sitting here in the Community Engagement Resource Center on the third floor of the newly renovated Truett Hall. So we've shifted from our old venue down at the library, and we're up in the new Truett Hall now. So let's start with your time at Touro. What led you to the Independent MPH program?
Yeah, so I was definitely interested in public health, kind of, I would say, forever. Both my parents worked kind of in health adjacent roles. My mom worked for the county of Marin for a significant amount of time within the health department, so had a lot of exposure kind of throughout my, I would say, teen years and young adult years to the field. I actually wanted to be a medical doctor from age 7 until about 25 is always what I say. So it was kind of a pathway that I was always looking into, is being in that more community health arena. And so went to UC Santa Barbara, finished my psychology degree, was still planning on being a medical doctor. I got into this master's program, and it's kind of what changed my mind. I went to school with some wonderful, brilliant, now physicians and pharmacists, and I just kind of learned that it wasn't the path I wanted to go to. I really wanted to lean more into the community health and nonprofit sector.
Okay. And what did you hope to accomplish in obtaining your Master's of Public Health?
That's an interesting question, because I'm not sure I knew what exactly was going to go on. I learned really early in my life that, just take things as they come, because nothing has really ever gone to plan or what I expected. But I did really want to come out of it with a lot of the relationships and connections, and doing my field study in Ethiopia. That was really important to me, to do an international field study, even though I was focused on community health, to just have that exposure to, how different countries and cultures handle their public health and medicine.
Okay, and what would you describe as your most significant takeaway from the program? Was it the time in Ethiopia, or was it something else?
Yeah, I would say it was, the time in Ethiopia was incredibly formative in my life, as it sounds like it would be. I learned so much about community health in different cultures, but also really started to hone in on the communications side of things, and within the United States and abroad, kind of how communications need to be formed effectively in order to really improve public health and advance that. So that was a big thing, but I also made a lot of lifelong connections among the students, very diverse student body. Again, I was in classes with doctors, soon-to-be doctors, now doctors, and pharmacists. So I feel like those relationships just don't go away. It was actually, a few years back in one of my colleagues' weddings in India. So,
Nice.
Those connections are just amazing.
Okay. I've heard a great deal about that in talking with alums about the relationships that are forged while going through any one of the graduate or doctoral level programs here.
Because we're going through it together.
Right. So you finished Touro, and then you went into the public sector. You served as a policy and communications analyst with Marin City Community Services District, and you served as a grants and court operations manager for the Hopland Band of the Pomo Indians, right? You were in marketing communications manager for Permit Sonoma in the county of Sonoma, and that particular role carried into the pandemic, which must have been really interesting. How did your MPH degree help you in those public-facing jobs?
Yeah, so that was really kind of where things started to shift for me after I came out of the public health program. And kind of found myself naturally in more of an operational, like nonprofit leadership kind of pathway in a lot of governmental organizations, very different governmental organizations. So we're talking about a special district, a tribe, and then county government. And so that's kind of where it started to shift a bit. And of course, during the public health program, there is coursework and experience in that element, in the more like administrative side. So I just kind of landed there, again, kind of leaning on the relationship development and that skill set around networking. I think that was a big takeaway and really applied. And of course, all the work really, I say public health's a way of life, not a profession. So it's integrated no matter what, like when you're working kind of in that governmental sector, because ultimately you're working towards, community stability.
So your time with Permit Sonoma spilled into the pandemic. I've got to believe that your public health degree came in handy as the operations at the county agency shifted as we entered the pandemic. Can you describe that experience for us?
Sure. So when I was with the county, it was actually 8 months of my 2 years was working in the Emergency Operations Center, because we have a lot of emergencies in Sonoma County during my time there. And so definitely I was very familiar. I'd become a lead PIO for the county by the time kind of the COVID situation hit. And yes, my public health degree, as well as that element of health communications that I had leaned into right after my field study, really kind of impacted my role, I would say, on the PIO team, really just kind of having that extensive experience and interest in health communications. And so, yes, that was very much applied. It was a long haul. I transitioned into my current role during COVID also, but I was a big part of like the communications for the county around COVID, working with all of the health department, like health and human services departments, to get that message out, because while folks are very good on the medicine or the public health practical side of things, communications might not be the strong suit. And so I was actually, I really was happy, not happy with the situation, but very happy to be able to be a conduit of that information and help kind of translate it for the public effectively. That was a really big role, and I was, I'm really happy that I was able to be a part of that, because it's important. I think it's critically important. I think the field really learned how important communications is in public health, and hasn't been something that's really been focused on. Now we're seeing, schools of public health or health have specifically like communications classes or focuses, but that's new. And so it hasn't really kind of reached all the way around. But I think we learned a lot from COVID.
So while this was going on, some of this was going on anyway, you were you had a weekly nonpartisan policy-based radio show, right?
I did, yes.
It was with Petaluma Community Access Radio, and you did that for darn near 5 years.
I did.
Talk to us about that a little bit, and also you kind of, while that was going on, you launched a podcast, Conversations with Domenica Park, right? Mm-hmm. And that continues today.
Yes.
Okay, so let's talk about all of that and how your expertise in public health supported both the radio show when you were talking about policy and also the podcast.
Sure. So I was actually on the board of Petaluma Community Access, and it was kind of an accident. I was asked to cover, because I have so much of that civic engagement kind of experience. I was actually one of the founding members of the Petaluma Teen Council when I was in high school. So this has been really a lifelong young adult commitment. So I was asked to cover Jared Huffman Town Hall, and kind of just do a recap the next day. And for 5 years after that, I had a radio show. It was kind of at the beginning of the radio for Petaluma Community Access, like having the arm, because there was the TV element of it. And so we were really just trying to get programming, and I landed. Initially, it was supposed to just be kind of doing some commentary or recaps when these town halls were occurring, because we were having way more of that conversation with the public. And so, yeah, because of that experience I had, I'm really, again, back to that communication side, I'm really dedicated to also being able to take policy, upcoming policy, and distill it down so that folks can really understand it, because there's like hundreds of pages of policies. So just trying to do my best to make it a little bit more tangible and understandable for people. So again, the public health, a lot of those policies have to do with health, because we talk about the social determinants of health, and that really encompasses every policy, I would say, because it's going to affect people. So certainly that tied in. I did transition into a podcast during COVID, because it was just easier and could do it at home. And so a little bit different of a focus now. It's more about just kind of talking to different diverse voices, which again, I think is very valuable.
So you founded Mabry Me, a consultancy firm, in 2013, and then joined Rams Inc. in 2021. So we're kind of moving in jumps through your career here. So tell us a little bit about Rams Inc., since that's like your full-time gig.
So I definitely want to mention Mabry Me a little bit.
Sure, definitely. We're going to get to Mabry Me.
Okay, so we'll go backwards, just because that's a big deal.
Let's start with Mabry Me.
Okay. Well, so the reason being is because, again, my career has been a little bit all over the place, and it's been long enough now that you kind of put the pieces together. The reason I think that it's important is because it's what shaped really a lot of my professional trajectory in a formal way. So when I came out of my master's, it was still kind of at the recuperation of the economic downturn, and so it was very difficult to get a job, and very much competing with folks that had been laid off, especially in counties and kind of that arena that public health folks would usually pursue. So kind of in response to that, I was trying to be resourceful and creative about how I approach my career, because I was working in a medical office, the same job I had when I was 19, and there's nothing wrong with that. It's just not exactly where I saw myself at that point with both my degrees. And so, kind of long story short, I really started networking and developing a lot of relationships, taking what I learned back in my master's program, because I wasn't the most, this version of me was not the version of me when I entered that master's program. So just taking that and making connections, and Mabry Me was really born. Initially, I was an independent consultant, and then it really grew to a consultancy where it's just kind of a referral network. Mabry Me, so the word Mabr in Amharic means working together with a passion. And so Amharic is the native language of Ethiopia.
Okay.
So that is, again, that full circle kind of connection. And through being able to start that company is really what built my reputation and led me to, I think, advance in my career very quickly, going from, that standstill in 2011 up until now. And so that really brings me to Rams, because the relationships is really, the saying, it's who you know, not what you know, is just, it's so true. What you know is incredibly important, but who you know has really been something that's been very valuable to me in my trajectory. And so, now I'm in an executive leadership position at Rams. Rams is a large mental health organization, relatively large. We're pushing a medium-sized business. In San Francisco, we provide kind of full spectrum mental health services. So everything from direct outpatient therapy. We also have a residential facility, which is, publicly funded and so accessible, which is a kind of a rare, type of facility to have in funding. In addition, we have the vocational services arm, because we know that working is a big part of our society, and ultimately the economic stability really improves mental wellness for folks, because jobs are just a critical piece. And then we also have a very robust peer division. So there is kind of the whole training peer counselors. And this is something that was talked about back in my master's program, and it's been talked about, and now it's finally getting traction, like 15 years later. And so RAMS was kind of one of the first organizations in the area to really build out this peer certificate, peer counselor pathway, and now they can actually become state certified as a peer counselor. So in addition to that, we're kind of training those paraprofessionals, and then also some of them work on our street crisis teams and our other street teams responding to nonviolent 911 calls.
Okay.
And so they're really providing that peer support to folks who might be experiencing some sort of crisis, and it's really kind of helping full spectrum, going from that initial touch point to try to get people into services. There's not enough. We know that, and so just doing our best, and it's been effective, and it's just inspiring. Like, I'm so honored to be able to be in an operational role. Sometimes we forget about those folks in nonprofits, but it's just a great honor to be able to support that work and spread the word.
Now, RAMS is a nonprofit itself, correct?
Yes.
So it's a nonprofit, and then it supports other nonprofit entities, partners with other nonprofit entities?
Partners.
Okay.
So we have a lot of community partners. We work very closely with the Department of Public Health in San Francisco. That's a big partnership for our crisis services as well as our others. So we have a lot of community partners. The organization's 51 years old. So that's a long time to meet other organizations in San Francisco.
Yeah. And you touched a little bit on, almost everything you described has a touch point with public health. Did I catch that correctly?
Yeah, and I actually don't want to leave out our Alameda County program, which is actually prevention and early intervention program for the Pacific Islander community. There's a large population in the East Bay, so I don't want to forget about that. And that's very, the two of the folks that are associate directors of that department also have their master's in public health. So it's really kind of focused on that prevention and early intervention. And RAMS in general, is trying to, across all ages, also making sure that we capture people where they are. And that's kind of the nature of public health.
So talk to me about some of the paths that you've seen that you could have walked and that others have walked with their public health. You went into, ultimately, executive leadership and communications. Mm-hmm. Many other paths. Can you touch briefly on some of those other paths that you've seen, even ones that are trailing through either MAPRE or RAMS Inc. right now?
Well, I can actually talk about some of the folks that I went to school with.
Okay.
I would say that there's definitely the medical path, so nursing, physician assistant. Some people did actually go on to go to medical school after. There's also a big part, I have some friends that are also going through a traditional PhD program, have done some international research. So actually one of my colleagues is about to do their defense, so I'm really excited to be able to join and see that. She did her research in India. Same friend, I was in her wedding. Okay. And so there's definitely that piece that I've seen even among those that I went to school with. I think that another pathway would be staying working in government. There's kind of that whole epi side of public health, I would say. Data people, number people. Right. So that I think that's also another pathway that I could have gone. I think working in direct services is another big one, whatever that looks like. And so, I do consider my pathway unique, and I always encourage people to kind of keep their mind open about what might happen, because you never know.
So you recently have joined the Alumni Association Board of Directors, so thank you for that. That was a little bit of a process, kind of a little bit of a lead-in, and then we had the election, and now the election's closed, and you've had your first board meeting. Mm-hmm. So thank you, first of all, for joining the Alumni Association Board. Why were you interested in joining the board?
Yeah, so I think that, based on my experience, helping ensure that other students kind of have an optimal experience, just being a part of that process, supporting alumni, and making sure that there are those connections back. was just really kind of a driver, and being a part, being back a part, I would say, of the academic environment. I love it. I think it's great. I've been in school for a long time, off and on. So I think it's really kind of invigorating and a good time in my life to give back.
Hey, you talked about being in school for a long time off and on. Talk to us about the doctoral program. I know it wasn't through Touro University California, but it was through Touro University Worldwide.
Yes. So, interestingly, I always said, my mom always said, well, you have been saying since you were 7 that you were going to be a doctor. This just wasn't the path that we thought it was going to be. It's not the path I thought it was going to be either. I was actually I had been looking into doctoral programs for, like 5 years.
Okay.
I was kind of trying to figure out, like, do I want to get my doctorate in public health? Is that the arena? Do I, which pathway? That was originally what I was looking into. Even at the time before COVID, there was a lot more robust online programs, or hybrid, where you had to go to campus every once in a while. So that was a big driver too, is because I wanted a program where I could still work and go to school. So that's kind of why I didn't go down the traditional PhD path. I know there are programs where you can do both, but it's quite difficult. It's very different. And so I did look into the Doctor of Public Health degree programs for a while, but really kind of reflecting, and this is why it took me so long, really kind of reflecting back on what it is I do and the application of what I do in my public health degree, and kind of in this more operational leadership role in nonprofits, I actually decided to go down the business pathway. It wasn't, TUW is definitely looking out for their students and future students. They asked me several times if I actually wanted to go into I think it's like the doctorate in health services or something along that arena, because my master's was in public health, and you're really kind of required to have a master's before you entered in order to do the short program. And I told them in writing and on the phone, and they're like, I really want to go down this business arena, because when we think about health, I actually have never held a traditional role in health when it comes to like direct services or healthcare administration. That wasn't really my pathway either. So I landed in this doctoral program. Didn't land,
Right.
Kind of did land. It was an expedited program because you had to have your master's first, so that was kind of considered your first 2 years. I did mine here in 16 months. And then you went on to do the 2-year program. So it was incredibly difficult. I always kind of tell people, my cohort started with about 15 students. We ended with 2.
Wow.
Yeah, it's not for the faint of heart, especially when you're working full time. It was just so much. And I talked to other folks that have gotten their doctorates, and I just always say I had no idea how emotional I was going to be. Like, it just breaks you down so much, because it's so difficult. And, you're really kind of testing your brain power and your emotional power, and, working 12 hours a day, essentially, all in all. So it was a wonderful experience. I think you do make those connections in those hard situations. So I actually recently went to my graduation. I walked to my graduation in July.
Great.
And so I got to meet some other students that were in other cohorts, but I got to meet that one person that I made it through, and it was just like this instant connection. And it's so amazing to kind of see other students and teachers and stuff that you don't see because it was an online program.
Right.
And there wasn't even lectures, because doctors are so self-driven that it was really just a lot of reading and writing. So it was just so great to see, put a face to a name. And yeah, now I'm actually pursuing getting published. It took me a while. I feel like I had to detox off the school before I could go back into my research, because I did primary data collection and stuff.
Okay.
My research was on communications among Bay Area nonprofits during COVID. I wanted it to be very timely, so it was just looking at communication satisfaction, kind of comparing those who worked in person to those who worked hybrid remote. And so it was really interesting. There wasn't a difference.
Really?
Yeah, there
Okay.
wasn't a significant difference between the satisfaction. So I found that to be very fascinating, and I think kind of leads up to future research, which I would like to continue to do with some smart people that work at universities, putting the plug out. And so, yeah, it was incredibly difficult. I always say adaptation is a human superpower, where it was a constant, balance between work, school, but I would never give it back. It was so wonderful. I proved to myself that I could do it. Yeah, and come out on the other side. And I'm done with school.
And now you're Dr. Giovannini.
Yes, I am. And also, going back to being on the Alumni Association, I really want to teach at a university level. And so, that just kind of shows my commitment to staying in academia, but being done with school.
Okay, well, that's great. We're about at our time.
Perfect.
So, everyone, thank you for joining us. It's the latest episode, of the current, the Touro University California Alumni broadcast. And on behalf of the university and Dr. Giovannini, I want to thank you again for joining us. Take care, everyone.
Bye.